Using ICD-10-CM. Like ICD-9-CM, ICD-10-CM features an alphabetic and tabular index. Coders use the alphabetic index to find the correct code and use the tabular index to confirm it. As with ICD-9-CM, we never code from the alphabetic index.
How to use ICD-10-CM. The medical coder should approach ICD-10-CM in the exact same way as ICD-9-CM. The coding process again begins with the analysis and abstraction of a medical report. Using their notes from the report, the coder may go straight to the tabular section or may refer to the alphabetic section to find the correct code, and then confirm it in the tabular. Let's take a look at a quick example. Patient is 44-year-old Caucasian male. Self-reported height and weight 1.8 meters and 80 kilograms. No notable medical history. Patient presents with a red rash around the nose and labial folds. Some yellowish-reddish pimples. Patient complains of itching and flaking skin. Patient says rash emerged 2 months ago, but then subsided. Diagnosed patient with suborrheic dermatitis and prescribed a topical antifungal medication. In order to code this relatively straightforward visit, the coder would first abstract the information in the doctor's report. The patient shows one very specific symptom, a rash on the face, and the doctor is able to make a positive diagnosis, suborrheic dermatitis. The coder could look this up in the alphabetic index or turn to the section in the tabular index for diseases of the skin or subcutaneous tissue, L00 to L99. From there, the coder would look for dermatitis and eczema and find L21, suborrheic dermatitis. Underneath that category, we'd find 4 subcategories. We'd select the one that best described the condition diagnosed by the physician, which in this case would be L21.9, seborrheic dermatitis unspecified. We use unspecified here because the other codes for seborrheic dermatitis pertain either to infants or describe an other seborrheic dermatitis. In this case, unspecified is our best option. You'll note that this ICD-10-CM code doesn't have any subclassifications or extensions. Remember, not all codes need to go to the level of specificity that ICD-10-CM provides. In this case, the 4th digit is all that's needed to describe the diagnosis. Let's look at another example, this time an injury. Injuries often have extensions that document the encounter because of stage of treatment, whether it has not been treated, as in an initial encounter, or it has already received treatment, as in a subsequent encounter, can greatly impact the medical necessity on a claim. Patient presents with bruising and a swollen nose and cheek after contact in a rugby match. Patient has not lost consciousness. Examination shows no rupture of the skin on the face. X-rays confirm a type 2 Lefort fracture. A Lefort fracture is one of 3 fractures of the bones in the face, including fractures of the lower and mid-maxillary bones and the zygomatic arch and cheekbone. We know right off the bat that this is an injury code, so we can start searching in the ICD-10-CM injury codes, found in S00 to T88. Injury, poisoning, and certain other consequences of external causes. From there, we'd winnow our search to S00 to S09, injuries to the head. Within that subfield of codes, we'd find S02, fracture of the skull and facial bones. Below S02, we'd find a number of subcategories, including codes for fractures of the vault and base of the skull, fractures of the nasal bones, and fractures of the orbital floor. We're looking for a very specific type of fracture, however, one that involves the maxillary and zygoma bones of the face. Thankfully, there's a specific subcategory for this, S02.4, fracture of the malar, maxillary, and zygoma bones. Once in the subcategory, we'd find a subclassification for Lefort fractures, S02.41. We'd select the code for our type 2 Lefort fracture, S02.412. Since this is the doctor's first encounter with the injury, we'd use the initial encounter extension A and would end up with S02.412A, Lefort type 2 fracture, closed initial encounter. As you can see, navigating ICD-10-CM is both similar to and different from using ICD-9-CM. Because ICD-10-CM provides a much higher number of specific codes, coders must be more accurate when reading and abstracting medical reports. ICD-10-CM, for instance, includes laterality in the code set, that is, what side the disease or injury occurs on. Information like this will be in the medical report, and so it's simply up to the coder to get every last bit of pertinent information from the medical report. Conventions. Like ICD-9-CM, ICD-10-CM makes use of a number of conventions that help guide the coders to correct diagnosis codes. Most of these conventions, as we mentioned in the last course, are the same in both code sets, and so we won't rehash them here. ICD-10-CM does have one significant upgrade, however, and it comes in the excludes convention. ICD-10-CM's excludes notes have been divided into two levels. The conditions listed in an excludes one note are mutually exclusive with the main condition the coder is looking up. An excludes one note informs the coder that if the code they are looking up is the excludes one note, the coder cannot, under any circumstances, use the code that houses the note. For example, you might find something that looks like this. A12, disease, A, excludes 1, disease, B, disease C. That is, if a medical coder is looking for disease B, but thinks the code for disease A would be appropriate, the excludes one note would direct her to look elsewhere besides disease A. Excludes 2 is the other new excludes note. An excludes 2 note indicates that the code above the note does not include the other conditions listed below the note. Let's take another look at our simplified example. A12 disease, D, excludes 2, disease E, disease F. This excludes 2 note means that while disease E and F might be pertinent to or related to disease D, they're not found in the same code as disease D. Unlike excludes 1, you can code conditions found in an excludes 2 note with the condition above the note. You can think of excludes 2 as sort of like see also, while an exclude note is more like a see note. The upgrade from ICD-9-CM to ICD-10-CM is set for October 1st, 2014. In the meantime, coders across the country are learning how to use this new large code set. In the next few courses, we'll introduce you to CPT codes, HCPCS codes, and their modifiers. These codes, along with the ICD codes you've just learned about, make up the heart of the medical coding profession.